right, so we are in Chapter 3, Pharmacy Operations, page 28. Each state board of pharmacy is responsible for licensing, monitoring, and regulation of pharmacy practice. Board of Pharmacy members generally consist of pharmacists and non-pharmacists, and they are usually appointed by the state's governor. Some states may require pharmacists to practice for a certain amount of time before they might be able to gain eligibility to serve as a member, or require that each pharmacist practice in a different pharmacy setting. So that could be community, hospital, ambulatory care. Non-pharmacist members may have to be a minimum age to serve on the board. Most states set a term length for board members and may limit the number of terms that an individual can serve consecutively or over their lifetime. In most states, pharmacist licenses are issued by the Board of Pharmacy, although a few states issue pharmacist licenses from other agencies like the Consumer Protection Agency or the Health Department. It is common to require a criminal history background check and fingerprints since the pharmacist has responsibility for drugs that could be abused and diverted. There are various requirements that an individual must meet to become a licensed pharmacist in a given state. So after graduating and completing the required internship hours, each jurisdiction essentially requires an individual to pass the NAPLEX. Most jurisdictions also will require the individual to pass the MPJE or whatever the equivalent jurisprudence exam might be. A few states have additional requirements such as an interview with the state board. Foreign trained pharmacists must complete the Foreign Pharmacy Grad Exam Committee certification by passing the Foreign Pharmacy Grad Equivalency Exam and the test of English as a foreign language. So once they would obtain their Foreign Pharmacy Grad Exam certification, the individual then has to complete the state's required intern hours. The NABP offers licensure by score transfer, which allows an individual to transfer their initial passing NAPLEX score to multiple states. All 50 states, the District of Columbia, Puerto Rico, Guam, and the Virgin Islands participate in the score transfer program. To utilize the score transfer program, an individual must request the score transfer through the NABP Once the score transfer is approved, then the NABP will send the passing score to the chosen state's licensing agency. The passing score will remain valid for a certain amount of time depending on the state. A pharmacist can also apply to transfer their existing license to one or more other states or jurisdictions. This is often called reciprocity. Most states require at least 1 year of practice experience before allowing license transfer. The NABP will facilitate the transfer. The individual state board can decide if the license will be granted based on their requirements. In order to obtain licensure by reciprocity, jurisdictions may require an individual to pass the MPJE or another law exam. They may also be expected to attend a Board of Pharmacy meeting or pass additional practice exams, for example, with compounding. Boards of pharmacy and other professional licensing agencies grant a license that certifies a minimum skill level and a certain number of CE hours has to be completed for each license renewal cycle in order to maintain competency. Pharmacists involved within a certain or specific area of patient care, like immunizations, may require continuing education in that area. It just depends. It'll vary by state. Pharmacists can participate in either live CEs. They could participate in literature-based CEs with then completing the quiz questions at the end and submitting for credit. There's a lot of different ways that CE credits can be obtained, but just check with your state to see what they have for their requirements. Some states will require a certain number of CE hours to be completed in live format. Most states do not permit any CE hours in excess of the current period's renewal cycle. They don't allow it to be carried over into the next renewal cycle. In some states, the first license renewal cycle does not require CE hours. The requirement might be waived with the belief that the pharmacist's knowledge is relatively current due to maybe graduating recently, recent intern experience, and preparation for the licensure exams. Pharmacists must maintain an active license to practice pharmacy. License renewal periods will vary, but are usually 1 to 3 years. The CE has to be completed within that renewal cycle to count toward whatever their state requires. If the license goes inactive, then they will not be able to practice. Reactivation may require retaking examinations or becoming current on CE and then paying an additional fee. At the state level, the Board of Pharmacies will offer certain specialty pharmacist licenses, maybe within nuclear pharmacy, or there could be a consultant pharmacist role, clinical pharmacist practitioners, or advanced practice pharmacists. So let's go over what those are. So a nuclear pharmacist, they essentially prepare and dispense radioactive medications for diagnosis and treatment of that patient population. A consulting or consultant pharmacist, they typically work with long-term care patients and they review medication profiles and regimens. They also will make recommendations in order to improve care. Consulting or consultant pharmacists, they must perform medication regimen reviews for each Medicare certified long-term care facility resident every 30 days. A clinical pharmacist practitioner or an advanced practice pharmacist, they are designated as a mid-level provider or practitioner, and they will oftentimes have prescriptive authority as well, especially if they work within certain veterans hospital systems, like within ambulatory care or psychiatry. Going on to page 30. Some of the states, they will offer one or more specialties. The pharmacists have to meet additional training in CE requirements within those specialties. Training requirements may vary between specialties and between states. Some examples include completing board-approved coursework in the specialty area, practicing under the supervision of another licensed specialist for a predetermined number of hours, passing the specialty exams and/or earning certification in the specialty area from the Board of Pharmacy Specialties, the BPS. Then we have preceptor pharmacists. So a preceptor is essentially a licensed pharmacist who will mentor interns during their advanced pharmacy practice rotations and any additional intern hours that may be required for licensure in order for them to become a licensed pharmacist. All of the states require preceptors to hold an active license in good standing, and some states require preceptors to also register with the Board of Pharmacy. A few states also require the training site to register with the board. All right, so we're toward the bottom of page 30. We're going to go over what a pharmacist intern is. So most states require pharmacy students to register as interns, obtain an intern license, and then be enrolled in the American College of Pharmacy Education, the ACPE accredited program. The expiration or renewal requirements for an intern license will vary by state. Some intern licenses will require yearly renewal, so annual renewal. Some may be valid for 6 years. Others may expire within a specified time period, like 6 months after graduation. Pharmacist intern experience essentially provides real-life pharmacy practice exposure. The most common requirement is to complete 1,500 practice hours, and then they are eligible for licensure. But this can vary by state. Some states permit hours to be obtained partially or solely as part of the curriculum in the ACPE accredited program. Several states permit interns to obtain hours which will count towards licensure in research or industrial settings under the supervision of a non-pharmacist professional. Pharmacists are responsible for the work of the intern. There are often ratios that restrict the number of interns that the pharmacist can supervise. Then we're going to go over pharmacy technician. So we're on page 31. So as we know, pharmacy technicians, they assist in the pharmacy. Previously, training was done on the job, depending on the type of help that is going to be provided. The first formal tech training programs were developed in the hospitals by the American Society of Health System Pharmacists, or ASHP. This was to ensure that the techs could perform complex tasks like completing accurate calculations and preparing sterile meds. Pharmacy tech training is now required in most practice settings. Regardless of the practice setting, the pharmacist who's supervising is responsible for adequately supervising all of the tech activities that are being performed. As a result, most states restrict the number of pharmacy techs that can be supervised by one pharmacist at a time. Many states will require pharmacy techs to be registered with the state board for the primary purpose of having the applicant attest that they have not been convicted of any felonies or misdemeanors, and they have not been involved in any criminal actions with controlled or non-controlled drugs. As part of the registration, a criminal background check and/or a drug screening may be required. It is common for states to require pharmacy techs to be at least 18 years old, to have a high school diploma or a general equivalency degree, a GED, and to not have a criminal history. Pharmacy tech registration generally needs to be reviewed pretty regularly. There are a handful of states that grant professional licenses to pharmacy techs. Licensure is more involved than registration, and it may include requirements like work experience, examinations, education, and tech training programs. Similar to the pharmacist license, a technician license would have to be renewed. It depends on how often, state by state. So it could be different than the schedule for the pharmacist renewal. Also, in terms of pharmacy tech certification, the ASHP Practice Advancement Initiative, it does recommend that pharm techs participate in advanced roles in all practice settings in order to promote efficiency and also to improve access to patient care. Technician certification programs are increasingly becoming required in order to achieve this goal. Moving to page 32. So the Board of Pharmacy, the National Association of Boards of Pharmacy, the NABP, initially published the Model State Pharmacy Act in order to assist each state board by defining the basic requirements for various areas of pharmacy practice. This document, which is routinely updated, it includes a discussion on the expanding role of technicians and the criteria for certification. All technicians can perform prescription data entry. They can assist with drug storage, insurance claim processing, and cashiering of medications. Certification may allow the technician to be involved with limited patient care activities. They could do data entry for a medication history, for example, or certification of the pharm tech might allow them to receive a new written or electronic prescription, as well as transfer prescriptions. Technicians who are certified will need to complete CE hours in order to retain the certification. The two primary certification exams are the Pharm Tech Certification Board, the PTCB certification exam, and the National Health Career Association, the NHA, certification exam. In some states, certified pharmacy technicians may have a greater scope of practice compared to non-certified pharmacy techs. Also, some states, in addition to providing a greater scope of practice for a certified farm tech. Some states may require that all technicians eventually become certified. Moving to page 33, so we have a page about disciplinary actions against pharmacy staff. So let's see, we have a chart at the top of page 33. So there's actions and descriptions